we had a bit of a trouble shaking off our blankets and waking up in the morning. I think nature did that to us in a bit of a fluorescent style. So it was probably nature's way of saying, wake up and go to the conference. I remember about 11 years ago, in July 2013, I think, I was supposed to give a commencement speech at the graduation ceremony of my residency class. And that day in the morning, maybe because of some nervous jitters, I ran a red light. This was in Chicago. And I made a joke during that commencement address, like when I was starting that speech, and I said, I was shaking off a little bit of my nervous jitters, and then I ran a red light in the morning. I think that might not have been a bit of a shaking off, but this certainly was a shaking off this morning. So, yeah. Gladly, it looks like we've not incurred any damage this morning, so I take that as an auspicious start to HAICon and the proceedings of our network. Distinguished guests, ladies and gentlemen, on behalf of the conference chairs and the organizing committee, the Health AI for All Network, co-hosts of this event, the Ministry of Health and Population, as well as the Nepal Applied Mathematics and Informatics Institute for Research. We're delighted to have you here at this inaugural Health AI for All conference. We're glad to have you join us today at this beautiful conference venue here in Kathmandu in person. I know several of you are joining from around the world as well, virtually, here in Asia, but also in Africa, in Latin South America, and elsewhere in the world. Welcome to all of you. The Health AI for All conference is a flagship event of the Health AI for All network. The Health AI network is a global platform for researchers, health workers, practitioners, policymakers, patients, their advocates, scholars, and all other stakeholders who are working to make sure and ensure that the benefit of Health AI accrue to all of humanity, with a special focus on people in resource-limited settings like Nepal. HAINet is designed to ensure that countries like Nepal, countries in the global south, are able to pool together our resources and rise up to the challenges and meet the promises of breakthrough technologies like health artificial intelligence. HAINet is governed by a global steering committee. 75% of our steering committee members will be based in resource-limited settings like Nepal, in countries in Asia, in Africa, in Latin South America, but also in countries in North America and Europe. HAINet is a platform for the Global South to drive an agenda on behalf of the Global South, and we're glad that important steps in founding and initiation of this important network have happened in Nepal. Thus far, resource-limited countries have not been able to meet their fair share of burden in the production of scientific knowledge, tools, and technologies that are required to meet everyday challenges like healthcare. Resource-limited settings like Nepal are often seen as mere consumers of scientific knowledge and technology, and not as producers. We believe that a time has come to change this. Resource-limited settings like Nepal, Kenya, Uganda, Mexico, India, Vietnam, China, even some of the other resource-limited settings, even in high-income countries, ought to take ownership of their needs and issues, determine their priorities, create a shared agenda, and marshal collaborative action to solve their own problems. Health AI offers us an opportunity to do so. The problems in healthcare are immense. About half the people in the world lack adequate access to essential health services. Millions die needlessly each year because they cannot access health services that are already easily available to some other people. And even when they do have access to health services, people face ruinous consequences of accessing health services. About 2 billion people around the world today face financial hardship because they have to access health services. Access to health services and the consumption of health services is one of the most important reasons for impoverishment of people around the world, not just in resource-limited settings and countries like Nepal and several countries in Asia and Africa and Latin South America, but also in North America and even in Europe. In most countries around the world today, healthcare is easily one of the most important domestic policy issues. Therefore, healthcare is an important global issue for all of us to work on. Good health is the ultimate wealth to attain. If artificial intelligence technologies are to realize the promise that they pose, making healthcare accessible and affordable and improving its quality is probably one of the single best areas for the application of artificial intelligence. Health AI is where the promises of AI will meet the realities of everyday life. If AI has to deliver, it has to deliver in healthcare. The single biggest issue in the delivery of affordable and accessible healthcare, or accessible access to health services, to people around the world, is probably the availability of trained health workforce and having the financial resources to employ this trained health workforce. Resource-limited settings are limited by their ability to provide health services, largely because they are not able to recruit the kind of health workforce that they need in order to do so. Health AI offers a major promise in offsetting this great bottleneck in the provision of health services. By some estimates, and these are some new estimates, large language models and their associated software technologies, when they are implemented in full, could reduce by half the time required to complete tasks in about 46% of information processing dependent jobs like healthcare. And that's just one AI technology domain. Other technologies like computer vision and image recognition could revolutionize how we diagnose aerial scourges like tuberculosis and cancers. Drugs and novel therapeutic molecules could probably be discovered at a fraction of the cost and time that it takes today. Health AI could make quality health services plentiful. Health AI is the single biggest opportunity to make sure that every person around the world, irrespective of where they are, including those in resource-limited settings, do not have to die a needless death because they could not access quality health services. But first, before that happens, we have to put in our fair share of work in ensuring that we realize the promise of health AI. Unlike in previous waves of technology, resource-limited settings ought to pull ourselves by our bootstraps. Resource-limited settings can come together, pool our resources, our efforts, our hands together, and be a net contributor to the global pool of public goods. Resource-limited settings have the people. More people means more needs, but it also means more hands. It also means more people who can generate ideas, and more people who can bring their work to bring those ideas to life. We have our data, and we could build our own models, and we could also build our own technology. Over the course of the next 2 days, you will be able to get a glimpse of how we might go about doing that. Our speakers will share their ideas about where we should be focusing our energies on and our ideas on what it is that it is possible to do with health AI and what might be possible to do with health AI in the future. We will also hear from our speakers about how we might go about in making sure that we develop health AI as a global public good and not merely as a consumer item created for the benefit of the few. The conference will also allow all of us, including the participants, to voice our hopes and fears for health AI and what our expectations are out of this generationally promising technology. We encourage you to actively participate in the conference, soak up all the ideas, build networks and collaborations, and actively participate in the discussions that are going to follow in the next 2 days. Tomorrow, toward the end of the conference, we will have a town hall discussion where all of us will be able to share and put our voice on the table. Please participate actively especially during the town hall session. We also hope that you are able to share go over some of the documents that we've shared with you at our tables. A few printed copies are available at our tables. One of them is a vision document that we've written, outlining our vision for how we might go about building the Health AI for All network. The second is a background paper on situating this entire discussion. It would be really helpful for, I think, all of you to go over that and give us your feedback. There should be QR codes available where you can access a form through which you can give your feedback during the course of the conference. And at the town hall session, we will all incorporate your feedback and have a discussion around those as well. I want to end by welcoming and thanking all of the speakers who have been generous with their time to share their insights and ideas with us. Welcome again, and thank you to all the participants for taking a break from your regular schedule and being with us here today. And welcome and thank you to all our partners who made this event possible and everybody else who's helped put this event together. We all look forward to seeing you here, meeting with you, discussing with you, and having a vigorous and refreshing 2 days of conference proceedings ahead. Thank you.